Hi everyone, welcome to today's Face Facts. Today we're talking all about the neck, what you should be doing, what you shouldn't be doing, and I really hope that this one is mind-blowing for you and that it changes your everyday skincare routine. Enjoy. Okay, welcome to today's podcast. And today Sophie is back.
Back again.
And today we're talking about neck.
Yes. It's a very common area that patients often come in about. I think it's also a forgotten area sometimes with patients. Patients often come in with the face and sometimes forget about the neck, or it's the other way around. So tell us a little bit more about neck and neck concerns that patients have.
So you're absolutely right. I think since childhood, really, people are talking about skincare for the face. And I often see patients in their 50s whose faces look about 30, but their neck looks about 60. And that's because they're not taking their skincare down to their neck. So it's really, really important, number one, that we understand that the neck is a continuation of the face.
Yeah.
And that the skin of the neck and the décolletage will age.
Okay.
And it ages at the same rate. But it's important also to consider that the anatomy of the neck is quite different.
Okay.
And the skin of the neck is thinner than the skin of the face. So you start to see horizontal lines, you start to see laxity in the neck, and you can start to see crepiness in the neck and décolletage. And it is a cause of a lot of concern. So this is an area that I treat daily, every single day in clinic. And I say to every single one of my patients, whenever I start off, I do a full face assessment and I look at their neck. And I say to them, prevention is better than cure.
Yeah.
Start looking after your neck from today. If you're listening to this, then please this is my take-home message, start looking after your neck from today. Any active ingredients you're using on your face should be taken down and used on your neck. Okay. Even retinoids. Now, obviously, that might be a bit of a leftover. So if I have my patients using a retinoid, the retinoid on their face and their neck is usually different. There is a specific retinol that I use. So it's really important that patients are not forgetting their neck. And when I'm treating the neck, I often put them on a retinoid for the neck. A retinoid is a vitamin A derivative. You have two options here. You can either take your retinoid down from your face onto your neck, but I say use the leftover. So put your creams onto your face, and any leftover on your hands, you can apply that on the neck. The skin on the neck is a bit more sensitive, and it takes a little bit longer to heal than the skin on the face. Or you can have a particular product for the neck. So one of my two favorite products that I prescribe to my patients, I use myself, is a product called Peptide Neck Repair for Retinoid Neck Repair for the neck. This has got peptides. Peptides are little chunks of amino acids that have been shown when using skincare and even in injectables to stimulate the production of collagen and to upregulate the expression of pro-collagen and the gene expression of collagen production. They also help with the improvement of the extracellular matrix, which forms part of the skin, and they help with the barrier function of the skin. So peptides are very, very important, and certainly have come a long way over the last decades in terms of skincare. Retinoids as well, but retinoids we might want a slightly lower dose than your strong retinoic acids on the neck. I prefer retinaldehydes or a retinol on the neck. And I say use lots of ceramides, cholesterols, fatty acids, hydrating factors that can help to improve the actual skin, the barrier function of the skin. So definitely do that. Sun protection, non-negotiable. If your neck is out and exposed to sun, then it's not just your face that needs sun protection. It's your face, it's your ears, it's the back of the neck, it's the front of the neck, and it's the décolletage and your hands. But that's a whole other podcast. So neck, the take-home message with regards to skincare is don't forget your neck. Right? And if you don't know what to use, then get in touch and we can help you. But one of my favorites is a peptide and retinoid neck cream. The other one that I like to use is Elastoderm on the neck, which is a product that has got malonic acid and peptides and really helps with hydration of the skin. I use one in the morning, my Elastoderm in the morning, and I use my retinoid peptide skincare in the evening.
Okay.
And SPF is non-negotiable.
Yes.
Unless you wear hijab like me and you're covered up, that's fine.
Yeah.
But otherwise, make sure that you're doing that. Now, the most common concerns that I see with patients in the neck is laxity. So laxity is going to form, and remember the anatomy of the neck is slightly different. You have over here on the face, you've got skin, you've got superficial fat, you've got muscle, you have deep fat, and you have bone. In the neck, the main thing that starts to change is the platysma. The platysma is a big sheet of muscle. If you imagine when men are shaving, they lift up their chin and they tense the platysma and then they shave.
Yeah.
So men and women will get platysmal weakening over time, and you start to get laxity. There is only so much that we can do non-surgically. So prevention is better than cure. If you can prevent the degradation of the neck, great. If you can't, then we need to have an honest discussion about, are you considering going down a surgical pathway or a non-surgical pathway? And a surgical neck lift can be done irrespective of whether that combines a facelift or not. You can have a deep plane facelift and a neck lift, or you can have a mini neck lift by itself. That's it. That's for you to decide if you want to go down the surgical pathway. If you make the decision, I don't want to go down a surgical pathway, then again, think about what's happening anatomically. The collagen is going down in your skin, the elastin, the hyaluronic acid. So start to plump up that.
Yeah.
You can do that partly with your skincare. We know that. We know that retinoids can increase collagen production up to 70% more than pre-use. And then also, of course, the sun protection, like we said. But then what other treatments can you do?
Yeah.
I do a lot of Radiesse and Sculptra in clinic. Hyperdilute Radiesse has actually just got its license for the use in the décolletage, which means that it's now on label. The FDA has approved this because of significant data to show that the use of this particular product in the décolletage can help to reverse the signs of aging, can help to treat laxity and lines and wrinkles. But, you know, when we talk about laxity, it's important to understand muscle laxity is different to the laxity in the skin, right? So kind of you're putting your skin, you can see a little bit more, the skin is looser.
Yeah.
That's different to I've got a heavy neck, right? Because that might require surgical intervention.
Okay.
So Sculptra and Radiesse might go to in-clinic treatments. And I like to do them as a precursor to any other treatments, because what I'm doing when I'm injecting a biostimulator like Sculptra or polynucleotides is I'm fertilizing my base. I'm waking up all of the fibroblasts, which are the cells responsible for collagen stimulation, hyaluronic acid, elastin. I'm waking them up. And then if I prescribe something like radiofrequency or an erbium laser, all of the fibroblasts are awake. They are ready to go. They are booming. They're like, come at me, girl. Yeah. So if you pre-fertilize the skin with something like Sculptra or Radiesse, and then you do your radiofrequency microneedling, or then you do your YAG lasers, you're going to get much better result because those fibroblasts have been pre-woken up. They've been rejuvenated. So that's my usual protocol. Sorry to interrupt the podcast. I am coming to you to say, if you're enjoying this, then I would really love for you to like, subscribe, follow along, and share this with anyone who might find this useful. We are investing a lot of time, energy, and resources into bringing you the best of the best in education, all about faces, bodies, aesthetics, and wellness. And I want to continue to do that, but I need you to subscribe. And if you can, if you have any questions, if you want us to address any particular topics, then please leave a comment and we will certainly create videos for you to address those. Thank you, and I hope you enjoy. That's if you have, so that's the skin.
Yeah.
Underneath the skin, you have fat.
Yeah.
And this area is a common cause of concern. I know it's an issue for you as well. You know, it's an issue for me. I've had a double chin since a young age. Some people just have a congenital double chin. Some people, it looks worse because their chin is retruded. So they have an underdeveloped mandible. If they have an underdeveloped mandible, just more like this, then of course you're going to get laxity here, right? And then as you age, I'm so sorry to break it to you, but your subcutaneous fat in your double chin area gets bigger. Happens to everyone. So if you look at your mom, your grandma, they are probably heavy here. Some people call it turkey neck, right? So that's a combination of laxity from the platysma, excess fat, subcutaneous fat or fat hypertrophy. We call this submental adiposity, so the double chin area, and skin laxity. So it's a combination. So if we want to treat that, then we need to categorize. Okay, how much of this is fat, and can I treat this surgically or non-surgically? So surgically, liposuction. Non-surgically would be, and you can also do an intervention using endolift, for example, which is an invasive laser. It's a true laser, 1,500 nanometer laser, using a fibro optic that slides underneath the skin and melts excess fat. The heat, the light from the lasers converts into heat, and it literally melts the fat. It heats it up until it melts, and then that leaves the body. You can also suck some of it out, and we can do that in clinic. That's a form of liposuction, so to speak. So that would be a little bit more invasive. A non-invasive option is cryolipolysis. This is where we use intense cold. And we freeze the fat to minus 11 degrees Celsius. Now, this particular treatment is called cool sculpting. I personally love this treatment because there's been over 12 million of these procedures performed worldwide. So it's exceptionally popular.
Yeah.
It's been around for over a decade, I think 12 years now. The submentum is an area of serious concern for patients. Not everyone has the budget for liposuction. Not everyone wants to have a surgical treatment. Not everybody has a budget for a invasive laser treatment. So cryolipolysis is relatively affordable, and there's no downtime. And that, I think, is the biggest thing.
Yeah.
Is they can do it as a lunchtime procedure and go home. Because yes, it's not instant. Yes, it's not liposuction. But what we are doing is we're freezing the fat cell to minus 11 degrees Celsius.
Yeah.
That makes those fat cells crystals, so they crystallize, and it kills them. And how this was discovered was in Harvard University after children were sucking on ice lollies and then got fat loss in the area where they were sucking on ice lollies for a long period of time. And they realized that extreme levels of cold can cause fat loss.
Wow.
I know, brilliant. So like now just sit in your freezer. So cold and heat can kill a fat cell, can destroy a fat cell. So it's an alternative to surgery. It takes about 6 weeks to start to appreciate results, but 3 months to see the full results, because as the fat cell dies, it's then left through, leaves through the normal lymphatics, like if you lost weight and it was broken down through your normal lymphatics. That I find to be exceptionally effective in patients who have larger bulk, and I want to debulk. Once I've debulked, I then like to use my endolift to take away the kind of the fine tune the fat. And the beauty of the laser is that we can also stimulate collagen production, because of the heat will stimulate collagenesis.
Okay.
Then we have muscle laxity. So when it comes to muscle laxity, ain't no amount of filler going to help that, right? And I think it's really important to understand that. Even in the face, you can't compensate for muscle laxity by adding a volumizer in. You'll just start to look distorted and fake. So understand that and treat it properly. When it comes to muscle laxity, we are very limited when it comes to non-surgical solutions. One of the options is high-intensity focused ultrasound. And remember that not all HIFUs are the same. This is something I'm really passionate about, because I used to offer a particular form of HIFU, which was quite painful, but FDA approved. Yeah. But I didn't like the fact that it was causing my patients pain. And that particular product has the ability of causing fat loss, unwanted fat loss. So I didn't want that one. So I now use Ultracell, Ultracell 2, and Ultracell Q+, which is our devices that are exceptionally safe and exceptionally effective. So much so that I bought an extra device. I've had it in my clinic for over 7 years. I need to get into it. I think I sent a message last night saying I need to get into this machine. And it's great because it works in multi-forms. It can be used to target fat with certain cartridges called the linear cartridges. And then there are other ones where we are sending deep heat into the muscle to cause that muscle to tighten and contract. If you think about taking a steak and you put the steak on a pan, what happens to that steak is it contracts, right? That piece of meat contracts with heat. It's the same in the muscle of the face or the neck. When you put deep heat in, it contracts. And if it contracts, it tightens and lifts. So that's a no-brainer. That's like, obviously do that, right? And the beauty of the Ultracell Q+, I don't get anything paid to say this, is it bypasses the fat. So you're not going to get unwanted fat loss. You need some fat in the neck. You need it to plump up. So those are the kind of the approach that I do is skin, fat, muscle. What's going on here? You have to diagnose, and this is not a giving bespoke advice. You need to see a patient to give bespoke advice, but those are the factors at play that we need to assess and then make the right decision for the patient. The other thing now that I'm seeing a lot of is tech neck. So a lot of people have their phone and they're looking down like this, and that is going to exacerbate the appearance of horizontal lines. So be mindful of that, especially younger generation, patients who are growing up now with devices. You will start to develop horizontal necklines. Get your neck up, bring your device higher, position it if you need to, but certainly consider your neck position for long-term health as well. And if you do have horizontal neck bands, then you can have fillers inside those neck bands, but just make sure that those fillers are placed in a very precise manner so that you're not getting unnatural lumpiness in the neck. And if you have strong muscles, like some people have this party trick where they do this and they're like, you get the neck bands, don't you? Some platysmal bands. If that's an issue, you can use botulinum toxin. And that's very cheap, very effective. Where we place botulinum toxin around the bands, and that actually lifts the jawline. So that's the multi-factor. That's the skin. We talked skincare. We've talked about the subcutaneous fat. We've talked about the muscle. We've talked about horizontal neck. We've also talked about platysmal bands. The last thing that I found and this is scientifically proven now, there's been multiple studies that have shown that fractionated radiofrequency or fractionated laser, particularly erbium glass laser, and CO2 lasers, these lasers they're light lasers that generate heat in the skin.
Okay.
Same with fractionated radiofrequency, like radiofrequency microneedling. When we are doing those, clinical evidence and systematic reviews on these treatments have shown that there's an improvement in what we call dyschromia, which is hyperpigmentation, and also an improvement in fine lines, wrinkles, and collagen production. It won't treat laxity.
Okay.
So if you have laxity because of deeper, it's not going to treat that, but it will improve the thickness of the skin and therefore the appearance of the neck.
Okay. Wow, that was
a big monologue.
That was a big monologue. I suppose the key taken from me from that is it's a multi-layered approach. It's not necessarily just a one treatment fix.
Absolutely.
It depends what the concern is, how the concern is looking.
Manifesting.
That's the word. So I think it's really important that patients do get the right advice and don't maybe assume what they think they may need. Get that advice and be willing to take it on board.
Yeah, and prevention is better than cure.
Yeah.
If there's one thing that I wish most people knew, because by the time they come and see me, and there's a difference in skin texture and radiance and uniformity of skin color and laxity, structure, the face looks phenomenal and then the neck gives it all away.
Yeah.
And they're so used to just looking at their face, they ignore their neck. But the rest of the world appreciates that difference. And then, I think one of the beauties of good aesthetic work is undetectable work.
Yeah.
Part of that is making sure that the surroundings are blended in.
Yeah.
So there's no point in having a 30-year-old face and a 60-year-old neck. Get it blended. If you want to do anti-aging treatments, blend it in, get your skincare all the way down the neck.
Yeah, and you see that in celebs, don't you? You can tell when they've had a facelift because
you see it in a lot of patients and a lot of people. So it's
the
very
neck,
common.
yeah,
the neck
it's really, that's the giveaway, isn't it? So what would be your top 3 take-home points for patients who are concerned with the neck?
Skincare down to the neck, non-negotiable. Don't ignore the neck, whether that's your vitamin C's or your retinoids or your SPFs. Get that product down your neck. Those expensive products need to also be working on your neck, but don't put strong retinoids on your neck. You may not tolerate it. You may need a standalone product. So speak to your aesthetic practitioner to advise you on that. But anything left over in your hands, if it's good enough for your face, it's usually good enough for your neck. Sun protection.
Yeah.
I cannot stress this enough. The number of women that I see, particularly summertime, so this podcast being filmed in August 2024, the number of treatments that I'm currently doing in the décolletage is unbelievable because it's all coming out now. And it's these vertical lines between the breasts that are a cause of concern for patients and is totally avoidable. This is 90% of that is a product of exposure to chronic ionizing radiation from UV exposure. It's a mouthful, but basically the sun breaks down that collagen and elastin in your neck and it really creates a heck of a lot of pigmentation and crepiness. So SPF, face, neck, décolletage, non-negotiable. And the last thing is don't be afraid to ask about the neck. There are so many treatments now available in terms of bioregeneration. It's not just fillers. Fillers are the last line approach when it comes to the neck. You should not be putting lots of fillers in the neck. Fillers should be really limited. Hyaluronic acid should be really limited to maybe just the horizontal lines. You can have skin boosters by all means. Skin boosters are fantastic. They help to improve hydration in the neck, but you don't need volumizers in the neck.
Yeah.
What you will benefit from is biostimulation, whether that is polynucleotide, Sculptra, or hyperdilute radies. Certainly find yourself a practitioner that can offer one of those.
Well, thank you so much for sharing.
Thank you for joining me.
Thank you.